Pregnancy can be both a time of joy and stress. About 7% of pregnant women experience depression during their pregnancy period. Now, these rates might be higher in low and middle income countries. Depression, we all know, causes a persistent feeling of sadness and a loss of interest in many things. It is the most common mood disorder in the general population. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be discussing about the early detection in depression during pregnancy. Depression in pregnant and postpartum people is a very serious problem. Rather than using a screening tool with a cutoff score to detect a depression in every pregnant and postpartum patient, clinicians should actually ask patients about their well-being as a part of their usual care. This recommended by a new guideline from the Canadian Task Force on Preventive Health Care, which has recently been published in Canadian Medical Association Journal. Now, however, there is little evidence that universal screening for depression using a standard questionnaire and cutoff scores, it usually improves the long-term outcomes for these patients, indicating that more research is definitely needed. The researchers were disappointed to find insufficient evidence of benefit to universal screening with a questionnaire and cutoff score. Rather, it is best for primary care clinicians, therefore, to focus on asking patients about their well-being at visits. The emphasis is on an individualized rather than one-size-fits-all approach. In creating the guideline, the task force engaged patients to understand their values and preferences around screening to inform these recommendations. The participants who felt strongly that a discussion about their depression state with their healthcare provider during pregnancy and the postpartum period is definitely critical. The guideline is aimed at healthcare providers, including physicians, nurses, midwives, and other healthcare professionals who interfere with pregnant and postpartum patients. It replaces the previous guideline from the task force that was published in 2013. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.